how do you evaluate the need for your senior now needing some help or assistance or guidance or input? You know the family member better than anybody, whether it's a close relative, a friend, a neighbor, a sibling, a spouse. You're the caregiver and you have watched them over a period of time, sometimes a very long time. So you can see the changes. You understand that they're not as active or as alert or as socially involved as they have been. It's the small signs that we sometimes don't always see. And it's up to you to be very conscientious as to almost imperceptible changes. Are they asking questions? Are they repeating themselves? Are they turning an ear towards you, which would indicate that they might have a hearing problem? Is their vision not as sharp as it was? Is their mind not as sharp as it was? And sometimes the senior, all of these things are happening to them so slowly that they are not aware of the changes. So it's up to us to be their eyes, their ears, their conscience, their guide, their helper, their support system. If you have any questions, take them to their primary doctor, an audiologist, have their eyes checked. Check out all the things where you might be able to assist them with a hearing aid or new glasses, or maybe their peripheral view is diminishing, which sometimes will make them fall more frequently. Or if they're holding on to a wall, that means their sense of balance may be off. There are so many little signs, but it's those little signs, if you are perceptive and aware, and you do some action in some way, shape, or form, those actions may save their life, save them from a fall. It's up to us to keep them safe, not just by putting grab bars all over the place, but by being very observant. And if you're at a distance and all you have is a phone call, then be aware of the changes in their voice, their tone, their moods, and also keep track of what time of day. You might find they're more active or less active in the morning, so their basic pattern has changed. Just keep track of it all, and when you see the changes, address them, taking into account the senior, and just say to them what you're observing and how can you together make it safer for them, have them continue to be as independent as possible, because that's always the goal. Their independence and their personality always taken into account.